Let me begin, if I may, just by asking a very simple question, which is, what are we all doing here in this room? For any clinicians amongst us, especially if you work in the NHS like I do, it's a very pertinent question. We all work these incredibly long, grueling hours. We burn out, we miss our children's birthdays. Why? Why are we all engaged in this matter of providing healthcare? I want you to keep that question in the back of your minds while I now tell you a story about medicine in a war zone, Ukraine. So I travelled to Ukraine at the end of last year, and this photo is a photo I took in our hospice just outside the city of Lviv, which is right on the western border, supposedly the safest part of Ukraine on the border with Poland. And this lady you can see here is a patient in the hospice. I've shared her photo with permission. She has a terminal lung condition, and incredibly, she is only 65 years old. If you look closely at what she's doing, you can see she's knitting, and she had no money at all, nothing to pay or donate to the hospice, but she's knitting pairs of socks for the doctors and nurses who are caring for her, because, as we know, one of the methods of war that Putin is using in Ukraine is targeting power infrastructure. So make the people cold and render them dark, put them in the dark. So she is making socks to keep her doctors warm. Before I explain what I was doing in Ukraine, I want to pose a second fundamental question. This is dear to me because before I became a doctor, I was a professional journalist for 10 years. And the New York Times back in the 1970s asked the author John le Carré this question. And in answer, he said the following, a brilliant answer to this question. He said, well, the cat sat on the mat is not a story, but the cat sat on the dog's mat, well, that definitely is a story. And here is another beautifully succinct example from Ernest Hemingway. So this is an example of flash fiction. The name was coined in the 1990s, and it denotes stories of extreme brevity. So Hemingway's story is only 6 words long, and it goes as follows. For sale, baby shoes, never worn. And now, the next story I want to share is from Ukraine. So this is a video that was shared on Twitter in November last year by Ukraine's Ministry of Defense, and it depicts a woman from the city of Kherson. So you may remember that Kherson was overrun by Russian forces right at the start of the war last February and occupied for 8 months before, in November last year, Ukrainian forces successfully retook the town. This is a video of a woman in Kherson, and it shows what she did as soon as Ukrainian forces came and liberated her streets in the town. And I just want you to sit back and savor this for a moment.
Рідненький.
Мокренький. Мокренький. Мокрий. Мокрий.
Ну, живой.
Ну, живой. Мокрый, но живой. Не так, вот так. Фу. Отходи.
So Curzon endured unspeakable events during their Russian occupation. This is a photo of one of 20 torture centres that were discovered by international human rights lawyers investigating war crimes in Ukraine. And these basements or rooms were used to incarcerate civilians, and they were tortured, beaten, raped, killed. There are hundreds of people who have vanished in Curzon. And this is all part of not just terrorizing the civilian population, but actually strategically trying to eradicate, erase all aspects of Ukrainian history, culture, the entire population. And I think that context just makes the video you've just seen all the more potent. Here is a woman who knew all of that, who knew that she had to appear subservient, obedient, not even have a Ukrainian flag on her mobile phone, or she could be picked up and taken to one of these torture centres. But all the time, she has buried outside her house this symbol of Ukrainian identity and defiance, that flag. So stories matter in medicine because fundamentally human beings are not inanimate objects. So a human life is the farthest thing from an apple falling inertly from a tree. You know, our bodies may be beholden to the laws of Newtonian mechanics, but a human life is governed by desire, ambition, pride, decency, courage, generosity, love. It has an arc, a narrative arc to it. And in palliative medicine especially, sometimes the most important thing I can do as a palliative care doctor is help a patient who has been dealt a devastating piece of news. They have a terminal illness, perhaps they only have weeks, days to live. If I can help them reshape their own biography, their own narrative, so that they feel as though what remains of their life, no matter how short, still has meaning and the capacity for beauty and joy, that can be more powerful than any amount of morphine. So, back to Ukraine. I was invited there with Henry Marsh, the neurosurgeon, to provide some teaching and training to doctors and medical students in palliative care. There is a desperate need for that at the moment. This is a video recorded 4 days ago by one of the doctors I met in Kyiv called Henry Marsh. He's a neurosurgeon. The audio isn't great, so I'll just explain. He's describing what happened right at the start of the war when the bombs began to rain down in Kyiv. They had to decide, do we save ourselves or do we save our patients? And they brought their patients down into the basement of the hospital to protect them. Subsequently, whenever he performs neurosurgery, if the air raid sirens set off and the patient is already anaesthetized on the table, they just carry on. So here is Andre.
This is one of the biggest hospitals in Kyiv, a residential tower, which is some 800 yards from here, was hit by a Russian missile on the second day of that war. We were preoccupied where to hide our patients, so we found a place for them in the basement. So we agreed on certain tactics. We can't operate and we cancel the surgeries if we can hear the siren wailing. If not yet, or if the patient is already anesthetized and on the table, we proceed with the surgery. Now we don't even care about the wailing. While our compatriots, military guys, fight in the front line, we can't afford to ourselves to stop doing our surgical work here.
So today, neurosurgery in Kyiv, and no doubt every other surgery, is being performed by surgeons who know they are risking their lives. They can hear the air raid sirens, but they carry on for their patients. It is extraordinary. I took this photo at the start of our trip in Lviv, really because these two young lads reminded me of my own son, who's 16, except he's worried about his GCSEs and they're about to set off to the front line for the first time. This is a wall of faces of all of the dead soldiers from Lviv, and remember, this is a city that's 1,000 kilometers from the front line, who have died in the fighting. So the war is a total civilian affair. The entire population is affected. There are the faces of some of the children who have lost their fathers in Lviv. We travelled to Sambe Hospice. It looks beautiful here. Met all of the doctors, did some teaching, but of course it's not beautiful. And this doctor, who's called Elena, explained to me what conditions are really like. There is a massive influx of displaced people from the east. Some 4 or 5 million people have been displaced across Ukraine. And here is an ambulance which is essentially stuck in the mud. They are digging it out of the mud and snow to get to patients. That was taken this winter. And here are soldiers who have travelled the 1,000 kilometres from the east with some of their colleagues who have sustained such devastating injuries, huge head injuries and so on, that they're terminal, and they are being transported to hospices in the east for their end-of-life care. We travelled from Lviv to Kyiv on a night train, and I was meant to do some teaching in another hospice there. However, overnight, as we arrived into the station in Kyiv, our mobile phones started flashing with alerts, and we discovered, to our, well, certainly my horror, we were entering the city at exactly the time Russia embarked upon a massive missile bombardment of the city, and the station was one of the locations targeted during that bombardment. So you can see the look on Andrew's face there on the left. He's not a man who gets worried easily, but he was worried. We all were herded down into the underground bomb shelter underneath the station. The missile strikes were so close while this was happening, and I took that photo. You didn't just hear the missiles landing, you felt them. They reverberated in your chest. There were windows being blown out. There was shattered glass in the street when we were finally able to come out. And I was terrified. The Ukrainian people have endured this for months. They looked pretty stoical. I was terrified. And I did what every good journalist does. I decided to get out my laptop and start writing. I knew, as a former journalist, that although we were not the story is what is happening to every single person in Ukraine and has been for over a year. I knew that the hook of 2 British doctors getting caught up in this bombardment would be a way of highlighting what was happening to the population. And indeed, I published this article in the Sunday Times, and it is entirely about what is happening right now to civilians in Ukraine. It's an example, I think, of how unbelievably powerful stories can be, not just in healthcare, but of course, in politics, in any human endeavour. Stories are the way in which we engage with each other, we care about each other, and actually they are a call to action. They are a way in which we enact change. Today, at this conference, you are going to hear about the most spectacular technological innovations that are helping patients. But I want to really remind you all of some of the less high-tech things that matter and that we should care about in healthcare. So morphine, proper pressure-relieving mattresses, 2 examples of decidedly low-tech interventions whose absence in some parts of Ukraine at the moment is causing absolutely desperate conditions for patients who are terminally ill. And perhaps the most low-tech intervention of all, the most humble intervention, and yet also the most profoundly human intervention that any of us can ever make as a healthcare professional, a doctor or nurse, is is that of storytelling. It is paying attention to your patient's story, hearing them, respecting the story, and perhaps advocating on their behalf by trying to tell that story to others. And with that in mind, I will finish with an announcement. I have not been able to stop thinking about Ukraine since I was there last October, and Henry and I have set up a registered charity called Hospice Ukraine, which I am very pleased to announce the launch of right now, today. There are details there of our launch event coming up in a couple of months, and rather cheekily, that is a QR code. And if any of you want to raise your phones, it will take you straight to the donate page of our brand new charity. If any of you would like to support us in any way at all, we would be absolutely thrilled to bits. Thank you very much indeed.